Now, the World Health Organization recommends that countries should allocate 15% of their national budgets to health. But Nigeria's yearly budgets over the years have failed to achieve this. Millions of Nigerians do not have access to health care and have no form of health insurance cover. The health system in Nigeria is currently grappling with a lot of problems, amongst which are the lack of adequate staff and equipment, access to healthcare services, amongst others. Now, the country is still reeling from the impact of the recent 10-day strike of the National Association of Resident Doctors that paralyzed activities at government hospitals. Experts say Nigeria needs to build a fairer and healthier world for everyone through quality medical and pharmaceutical care. Well, joining me is the CEO Health Emergency Initiative, Paschal Achunine. He'll be talking to us about this. Good morning. Thank you for joining us on TVC Breakfast. The doctors, that is the National Association of Resident Doctors, embarked on a 10-day strike. They initially had a warning before they embarked on the strike. They said initially that it was going to be an indefinite strike until the government, looked critically into their matter. And after 10 days, they called it off. But then when you look at the issues, they said that these are the same issues that they have been, talking about with government for the past decade. And one wonders, is it so challenging to address these issues that these doctors are calling for? Is it such a challenge for us to look into our healthcare sector and know that there are issues that has to be dealt with? In fact, how did we get here in the first place?
It's exciting to know that they called it off. Is it some relief to temporary relief, though, to the patients, to Nigerians, and indeed some people who are still grappling with COVID because they had threatened to extend the strike to isolation centers and other facilities managing COVID. We had expected that the event of last year, the pandemic, will force us to think, will force us to reason. And when I say we, I'm talking about stakeholders and especially the government. But it's shocking that we'll always firefight. We'll always try to patch up. When the notification for this strike came, some of the topical issues are so laughable. A 5,000 naira hazard allowance. That's plus or minus $10. If you check the exchange rate. Paying doctors who died in the course of national assignments. In the UK, for every health worker, especially doctors that died, they paid the family £65,000. In Ghana, they increased the welfare of doctors, health workers by 50% once the pandemic came. You pointed out that 15% is what Africa Union prescribed as the minimum threshold. Our 2021 budget for health is less than 7%. The shocking part is that what we see, whatever we hear from the news, from the media, represents less than 10% of what actually goes through in the system. The incidence of sudden death, there are multiple epidemics that are happening within the system. I expected that the sense of patriotism would drive this engagement between the government, the doctors, and other stakeholders. It's not just the doctors. I listened to a nurse. Most of them are bearing the pain patiently. And their response is, let me find a way of getting out away from Nigeria. But if you leave Nigeria as a doctor, as a nurse, not all your family members and relatives will migrate. You still have some of your kids and kin here. So for how long shall we always go about things in a reactionary manner?
No, for them, they are saying that they have been patriotic enough. Over the years, whenever they call for strike, they end up calling it off. Because the question on the lips of a lot of Nigerians is, why can't you deal with this heads on once and for all? Why do you keep having to talk about this whole issue for the past decade, the same issue for the past decade. So patriotism, I think, is not really their challenge now. Perhaps that is why they are trying to drive home the point now, and we have seen the impact.
So when I talk about patriotism, I'm actually pointing to the leaders, the government, the politicians. Because if a doctor sees that this politician or this public office holder is living, this is the lifestyle, these are the priorities where government is committing more resources, and those things do not strike a chord with the average Nigerian, who does not strike a chord to prudent management of resources. So they feel, okay, if strike is the only tool that the government listens to, they will employ it. But I'm glad that the House of Reps, National Assembly, and the executive, they came together, they engaged, and they called it off. So before the next strike happens, this is...
You are foreseeing that there will be a next strike?
No, it may not be today, it may not be the next 3 months, but we don't want another strike. And we want measures and mechanisms that will mitigate another strike. So say before the next strike, because it could, after all, it's not only in the health sector that we have strikes in recent weeks.
Absolutely.
Several sectors also witness strikes. But because health is critical and we are losing a lot of talents. So the way we need to look at this is that 20% out of every child born in Nigeria, 20% of them don't see their 5th birthday. And that 20% can be great minds who could be in MIT and other parts of the world coming with outstanding innovations. They could be some of the football stars, but they've not been given a right to succeed, to stay alive. I have been involved in the last 4 weeks with a family whose 3 children were infected with meningitis. And it happened in Makoko. They took the child to Makoko. The mother traveled. By the time she came back, the children were infected. And tragically, there is no technical report from health facilities that this is the trend we are seeing in ABCD. That child is still unconscious as we speak. Our organization has committed a lot. We had to reach out to a lot of organizations and individuals to provide support. The younger sister, 8-year-old, died because of this. She died on the 17th of March. The second one was urinating blood. And when we saw that the thing was getting out, we had to, it's a public facility, we had to get involved. We have paid for several pints of blood, several drugs. The surviving brother, there were 2 of them that are surviving. The second one currently is struggling to see very well because of the effects of the meningitis. So there is pandemic of meningitis. And some of the doctors who are attending to them say, we have been so stretched using our personal money because poverty is so much that the parents can afford the basic drugs. What are we doing to avert? This one is 10 years now. The other one is 8 years. The 8-year-old is dead. There are more thousands of these happening daily. So we must look at the issue from a holistic angle. Welfare of the medical team. We need to address it. And the Nigerians are willing to make sacrifice if they discover that as a leader, as a government, you are sincere. 2, we need to look at infrastructure. We need to look at availability of medical consumables. We need to look at funding, sustainable funding. And we have a GDP of over 400 billion. It means that there is still a lot of funds with the private sector and more Nigerians, because this case actually showed me the way many Nigerians responded when we brought it up, even corporates.
No, of course, a lot of Nigerians
they just want
willing to help.
Process that, oh, this person, when we commit resources to you, don't divert it. That's actually what has earned us the trust from them. It's emergency initiative. So we must look at this in a holistic manner and get the private sector involved. You could see that vaccination now, we are also going to run into crisis. WHO said there will be delays, and because of the second wave in India, where the last batch came from, we are not likely to get anyone so soon. So we have issues around that. We must come to the moment of truth as a nation.
I mean, these are issues that we have spoken about over and over again over the years. And one wonders if anyone is listening, if we are learning lessons. We have had to deal with, this is the first pandemic we are dealing with, but we have had other health crises that we have had to deal with, and we knew how it stretched our facilities. What is it that we are not learning? Why is it so difficult to address these issues? Primary health care is still a major challenge.
It's a near disaster.
Secondary health care is also another one. And then you talk about tertiary, the gaps. I mean, these
I
issues.
think what is lacking is political will. But the political will, we must grow it, we must nurture it. We must
Who
also,
does the nurturing? The people or the leaders? Are they willing to nurture? Are they willing to
I think it could be done.
face this
If you look at Lagos State
critically?
Security Trust Fund, for instance,
Yes.
significantly, most of the patrol vehicles and other infrastructure required to keep significant level of law other than Lagos is being funded from them. Because it's private sector driven in the context of funding. So last year, one of the financial institutions launched a program with us, our organization, Medical Intervention Trust Fund, to address ABCD. So private sector has a role to play because they feel, I actually want to emphasize this, most times people in the private sector will feel that it's the government's work to do, it's the government's thing.
The government has a major role to play.
I'm coming to the government.
All right.
Private sector must say, okay, let's even come together. Let's put in place a collaborative measure that designs a medical intervention trust fund that addresses I mentioned infrastructure, I mentioned welfare, I mentioned manpower development. It's also infrastructure and medical consumables. And then a buffer where in the event that indigents have cases that are taken to hospital, so most times less than 20,000, that fund can address it.
Yes.
I'm not talking about health insurance, so it can eventually be embedded, but this is a way to go. But the public sector must also know that it cannot govern in isolation. So if we have a GDP as much as 400 billion, it means that we can harness it very well by working with the private sector. But more importantly, it's about priority. So you can't, if you're in a year, you can't budget 7% in the health sector and expect an outstanding phenomenal outcome. It would still be developed by this kind of outcome we see currently. Government must recognize that it needs to increase its budget allocation. It must handhold private sector. It must also invest in data and research.
Right. I was going to go there because data and research is one critical aspect that Nigeria is said not to be doing well with, especially. But sometime last year, the federal government, through the Minister of Health, launched a roadmap for the health sector guided by the President's Health Sector Next Level Agenda 2019. Now, one key aspect was collaboration with private sector investors to establish high-quality hospitals and also look at the current reduction in the current imbalance in the primary, secondary, and tertiary healthcare. But not much. I mean, it's just last year. One wonders, this handshake, so to speak, talking about collaborating with the private sector to look into building hospitals, equipping hospitals. I mean, how far would that have gone if something had begun as at the time this was launched?
So I'm excited that there are those policies, there are those initiatives, there are those objectives put forward in the public domain. But if you go back in the time, over time, you'll find out that this is not the first time
we are having this.
Have been pronouncements have come from the government, but it still comes to the political will. But I think that why I say private sector is that there may be things private sector may be doing. Taking a cue from this, for instance, if you're doing A, B, C, D, it would force the hands of government to literally work with you. If the banks, for instance, the bankers committee say, okay, this is our strategic agenda for the health sector. The way we worked in agric, we deployed some money, some intervention funds went into that this is what we want to do. Not just some part of it can be a loan, some parts of it can be grants, but to support genuine actors that are involved in changing the face of the health sector. You will see that somehow it would force the hand of government to work with you. But I wish the government that we have this only country. We can't just watch our people die. You see of personalities. Suddenly, oh, this person died, this person died. And the ones you hear that are dead, I'm not talking about violent cases now. No. I'm talking about natural. Okay, look at malaria, for instance. Nigeria has 23% of total death rate of malaria annually. 403,000 is the total death across the world. A country called El Salvador in the Caribbean, just eradicated malaria completely.
So these are the issues hindering us from meeting our targets.
Absolutely.
The SDGs and all of it.
Those SDGs, we are just looking at them as if it's a paper. It doesn't, there's no functional action plan that is designed. Okay, this is the milestone. In 1 month, in 1 quarter, in 6 months, in 1 year,
we follow up on
track it.
Yes.
And
that's where data comes in.
Yeah, that's where data comes in. So we've been, because our intervention, our health emergency initiative is at the lower end of the pyramid. People who typically do not have 20,000 naira to pay for medical cases, and you watch them die. So our interaction with the hospitals, we realize that there is no system that stands in the gap, that comes handy. And if you check, if you do a proper analysis, over 30% of deaths in Nigeria are associated with things that can be handled at the primary health care level.
Absolutely.
So, and we are just watching it. Oh, this is, we lost him, we lost him.
For how long will we keep watching? So, because we are even losing the hands.
If you refer to the Bible, there is a place where Prophet Ezekiel was told that, keep saying it, maybe it could, let it be that they heard it. So, those in government, those in the private sector, those in the social sector, because again, I also want to emphasize, CSR budgets of private sector organizations are still tilting towards entertainment. We'll never learn lessons from COVID-19. I'm not saying entertainment is good and exciting. Music is the food of the soul, but why not tweak it until we come out of this crisis in the health space? Donate more, commit more of your CSR.
Because some of these people, even in the entertainment sector, you will recall that a lot of them lost their lives.
Absolutely.
Because of health challenges as well.
And from the report you shared, health insurance coverage in Nigeria is less than 5%.
Right.
So many are paying out of pocket. And because
it's not pocket friendly at all.
It's not pocket friendly, and people manage, okay, let me see, let me go to the pharmacy, I buy it before, and it gets out of hand. So cases that if you had managed it well, you had a health insurance, maybe it could have been less than 50,000. It goes into hundreds of thousands.
But also the talks about not having enough health management organizations available options. There are limited numbers, that there are no options for Nigeria.
I think if it's in the numbers, we have the numbers, but the enforcement and regulation is a
challenge.
Yes, because most people have had negative feedback about their experience with HMOs. So not all the HMOs keep to what they committed in writing they would do. So until it goes back to who are the regulators. So a lot more, all of this comes back to make the environment. I've read a lot about South Korea. It's still private sector driven, but the gatekeepers, that's the people in government, they make sure that you don't undermine public interests. Whether you're an HMO, whether you're a hospital, whether you're in business, public interest is critical.
Which is also one very key issue that has to be dealt with. Now we're talking about data collection and records, which drives is a major driver for especially policies being made. But when it comes to that aspect, we are really, really not doing well. That is what a lot of us are saying. And I mean, the implication moving forward, especially when we are looking for results, especially when it comes to the healthcare sector, and pushing it forward such that we can manage pandemics. I mean, it talks about there might be other pandemics coming on later in the years, and we just had one, and we are overstretched already. So
prior to the advent of ICT,
right,
information technology, our attitude to data was lousy and indifferent. But we can leverage on ICT. You've seen many programs that they deployed technology solutions and digital solutions, and you saw that we were able to access data. Because if you're a funder, if you're a government, you must figure out, this is my M&E, and the M&E cannot run monitor and evaluation objective of any program. It can, like the one that the president launched last year, if there's no inherent M&E, and that it cannot run without data. So I think it comes back to consciously, part of the planning process, part of implementation process is that we must deliberately conduct surveys, we must deliberately assess data. We must also avoid, because one of the things that many Nigerians also are cynical about is they realize that data that so person issues a data. I'm not talking about MBS now. They say that this data is who it doesn't have credibility. No, it doesn't have credibility. So our body language, the way the government business is conducted, the way government pronouncements and policies are conducted, it will reinforce trust in people. It will make people win confidence that, government now means well for us. So if government is also generating data and share it, people can place reliance on it. And private sector can also invest in data management and
data
storage.
is what is driving the world now.
It's the new oil, as people say.
So it is high time that Nigeria begins to embrace this aspect of data mining, data collection, and analysis, which is...
And research, like you mentioned earlier. So we can't keep doing things blindly. You conduct... So why are people... For instance, when you see that this is a trend, like I talked about meningitis, sepsis epidemics now. Okay, where are the locations, where are the areas that it is most endemic? So conduct... Map out, carry out research. What happened? How do we mitigate it? How do we avoid it spreading to other communities? And how do we isolate the cases and follow them end to end? Research, and I said it on this platform, one of the occasions I came, that in Harvard and other parts of the world, and other institutions, other parts of the world, truly, a portion of annual profits of organizations, private sector, go into research. It does not require government, essentially, that government budgets into it.
Okay. You can wrap up what you wanted to say.
So, in conclusion,
yes,
we commend this sportsmanship. Nobody, no victor, no vanquish, and that the strike is over. We also desire that let's move from talking to walking. Let's walk our talk as government, as private sector, and as individuals. Absolutely. This is our only country. Let's make it great.
All right.
Let's create hope for the weak and the vulnerable.
Absolutely. CEO Health Emergency Initiative, Paschal Achunine. Thank you once again for your time.
It's my pleasure.